Ladies and gentlemen, the inaugural lecture of Francis Lee Professorship in Precision Oncology by Professor Brigette Ma now commences. Please rise for the official procession. Please be seated. My name is Janice, a Year 3 student from the Faculty of Medicine, and I am part of the Global Physician Leadership Scheme under Professor Brigette Ma. Thank you everyone for attending the inaugural lecture today. To begin with, let us welcome Professor Dennis Low, the Vice Chancellor and President of the Chinese University of Hong Kong, to deliver a vote of thanks to Mr. Andrew Lee. Professor Low, please.
Mr. Andrew Lee, Mr. Douglas Lee, Professor Brigette Ma, Professor Ronald Ma, colleagues and friends, ladies and gentlemen, good afternoon. It's given me great pleasure to welcome you to this memorable event to celebrate a remarkable milestone in the career of Professor Brigette Ma from the Department of Clinical Oncology of the Chinese University of Hong Kong. We're here today to commemorate her inauguration as the Francis Lee Professor of Precision Oncology. This momentous occasion would not have been possible without the generous support from Mr. Andrew Lee, Chairman of Andrew Lee King Fund and Associate Architects Limited, who has kindly established this esteemed professorship in the name of his beloved wife, Mrs. Francis Lee. So on behalf of CUHK, I'd like to propose a vote of thanks to Mr. Lee for his generosity and commitment to advancement of CUHK as a civic institution in pursuit in excellence in education, research, and innovation, putting well-being of humanity at the heart of everything we do. CUHK takes great pride in building a strong connection with Mr. Lee through the participation of his good self as a registered architect and his company in construction projects of various campus facilities, including the Wu Yi-san College, the Yasumoto International Academic Park, Wu Hou Men Yun Building, as well as the student hostels and the Lo Kui Song Integrated Biomedical Sciences Building in Area 39. I think we can say that CUHK campus won't look the way it is without Mr. Lee's innovativeness. Maybe we'll give applause to Mr. Lee. Mr. Lee has once said, "Good architecture makes you feel good and should create an environment which enriches the lives of people and the whole community." Embedded in his spirit is a strong dedication to social responsibility. He has made tremendous contributions to the community, not only by engaging actively in professional organization and governmental advisory boards, but also by supporting the development of Hong Kong education sector. For example, through the provision of scholarships and his engagement with the council, committees, and academic departments of many universities. Now today, we are grateful that the goodwill of Mr. Lee extends to CUHK education and research arenas with the establishment of the Francis Lee Professorship in Precision Oncology. An interesting fact is that Mr. Lee actually once thought of becoming a doctor when he was young, and he even spent his university freshman year in the medical school before deciding to pursue a lifelong career in architecture. Now, as a magical coincidence, actually Brigette Ma actually was the reverse. She actually thought about actually being an architect first before she decided to actually switch and do medicine. Now today, in her inaugural lecture, A Tribute to Space and Time, Professor Ma will share her insights into how the work of architects and doctors, which seems worlds apart initially, revolves around the common goal of seeking the best possible way to cater for people's needs. She'll also talk about how an unforeseen turn of events drove her into the field of medical oncology, embarking on a journey to challenge existing paradigms in order to discover innovative solutions for this very terrible and serious disease worldwide. So thank you very much, Mr. Lee, for gracing us with your benevolent act, which will enable the university to remain at the forefront of transformative medical research. May I also take this opportunity to extend my warmest congratulations to Professor Ma on receiving this well-deserved honor, which will encourage her to unlock endless possibilities to advance global health and create a lasting impact on the world. So ladies and gentlemen, I wish you a most enjoyable time, and thank you.
Thank you, Professor Low. I now invite Professor Low, accompanied by Professor Ronald Ma, Acting Dean of Medicine, and Professor Brigette Ma, to present a certificate of appreciation to Mr. Andrew Lee and Mr. Douglas Lee. Mr. Andrew Lee, Mr. Douglas Lee, Professor Ronald Ma, and Professor Brigette Ma, please. Thank you. Please be seated. Professor Ronald Ma, Acting Dean of Medicine, would like to introduce Professor Brigette Ma. Professor Ronald Ma, please.
Vice Chancellor, Mr. Andrew Lee, Mr. Douglas Lee, Professor Brigette Ma, distinguished guests, colleagues, ladies and gentlemen, good evening. On behalf of Dean Professor Philip Chiu, it is my great honor to welcome you all to today's inaugural lecture. On behalf of the Faculty of Medicine, I would like to extend our heartfelt gratitude to Mr. Andrew Lee and Mrs. Frances Lee for their generous support in establishing the Frances Lee Professorship in Precision Oncology. This professorship recognizes and celebrates excellence in the field of precision oncology, advancing knowledge and treatment to improve the lives of people with cancer. It is with great pleasure that I introduce Professor Brigette Ma, our inaugural lecturer for today. Professor Brigette Ma is currently professor and honorary consultant at the Department of Clinical Oncology, the Chinese University of Hong Kong, and medical director of oncology at the CUHK Phase 1 Clinical Trial Center. She received her undergraduate degree with honors at Monash University, Australia, and was awarded Fellow of the Royal Australasian College of Physicians, Fellow of the Hong Kong College of Physicians, and Doctor of Medicine at CUHK. She underwent training in medical oncology at the world-renowned Peter MacCallum Cancer Institute, Melbourne, and was also Clinical Research Fellow at the Princess Margaret Hospital, Toronto, Canada. Professor Brigette Ma is dedicated to the development of innovative anti-cancer immunotherapy and targeted therapies, advancing the practice of precision medicine and multimodal therapy in the treatment of head and neck cancer and colorectal cancer. As the study chair of International Cooperative Group studies, including NRG Oncology and US National Cancer Institute Cancer Therapy Evaluation Program, as well as being principal investigator of sponsored trials and investigator-initiated clinical trials, she has played a leading role in clinical research in nasopharyngeal cancer, colorectal cancer, and early developmental therapeutics. She's also co-I and co-principal investigator in several major government grants, including the Collaborative Research Fund in Precision Medicine in Colorectal Cancer. In 2023, she received the 7th Kobayashi Foundation Award for her contribution to research in nasopharyngeal cancer. She has published over 220 peer-reviewed articles, including book chapters, and also co-authored many papers in high-impact journals such as the Journal of Clinical Oncology, Lancet Oncology, the New England Journal of Medicine, Cancer Cell, Nature Medicine, Nature Communications, to name but a few. Professor Brigette Ma has a long history of service of several influential international oncology societies, including the European Society of Medical Oncology, ESMO, the American Society of Clinical Oncology, ASCO, and the American Association of Cancer Research, AACR. Notably, this year, she is appointed as the council member of ESMO, which has over 40,000 members and consists of a group of around 18 distinguished scientists who have made significant contributions to cancer research and who advises the ESMO Executive Board on strategic developments. She has served as scientific co-chair for several important events, including the ESMO Asia 2023 Congress, the ESMO Asia Early Drug Development Advanced Course, and the ESMO Targeted Anti-Cancer Therapy. Professor Brigette Ma has contributed to the development of clinical guidelines such as the first ESMO practice guideline for metastatic colorectal cancer and the American Society of Clinical Oncology and Chinese Society of Clinical Oncology guidelines for nasopharyngeal carcinoma. Recently, she has been invited to be a member of the ESMO Early Detection and Prevention Task Force dedicated to the development of expert recommendations in cancer prevention strategies. Over the years, she has served as the keynote speaker, the track chair, and oral discussant at numerous international research and educational events and conferences, including the ASCO Annual Conference, the ESMO Preceptorship Programs for Head and Neck Cancer, GI cancer, and immunotherapy, as well as advanced courses in drug development and the development of antibody conjugates in GI cancers. She has served on many international research committees, such as the US National Cancer Institute Head and Neck Cancer Steering Committee and the Clinical Trials Planning Group on Nasopharyngeal Cancer, Women in Cancer Research Group of the AACR, and the ASCO International Affairs Committee, as well as the NRG Head and Neck Committee. Amongst her many other roles, she has served as associate editor for prestigious journals such as Oral Oncology and is a member of the editorial boards of the Journal of Clinical Oncology, ESMO Open, ESMO GI Oncology, Clinical Colorectal Cancer, and Therapeutic Advances in Medical Oncology. Locally, she's chair of the CUHK New Territories East Cluster Ethics Committee for Phase 1 studies. I welcome you all again to this inaugural lecture today in deepest gratitude to our donors, Mr. Andrew Lee and Mrs. Frances Lee, for the most generous support to the advancement of cancer research in Hong Kong, as well as celebrating the resilience and marked achievements of our colleague, Professor Brigette Ma. Ladies and gentlemen, please join me in welcoming Professor Brigette Ma to the stage.
Thank you, Professor Ronald Ma. I now invite you and Professor Loh to take your seats in the audience. And ladies and gentlemen, please join me in giving a warm welcome to Professor Brigette Ma. Professor Ma, please.
Vice-Chancellor, Pro-Vice-Chancellor, Mr. Andrew Lee, Mr. Douglas Lee, Acting Dean, Chair, distinguished guests, ladies and gentlemen. It is my great honor to stand here today delivering the inaugural lecture of the Frances Lee Professorship in Precision Oncology. Brigette Ma is actually not the reason why we're here today, however, because this lecture is a tribute to the generosity of Mr. Andrew Lee and Mrs. Frances Lee. More importantly, this is a tribute to 3 patients who fought their cancers valiantly, and their real-life stories are testaments to the impact on precision oncology in extending their lives and extending the lives of so many people. I am your storyteller today, a doctor who actually once wanted to be an architect. I love architecture because I think architects are like magicians. With a stroke of pen, they can redefine space. And Mr. Ian Pei, indeed, is one of my heroes. And this is a photograph of Mr. Pei in front of his iconic glass pyramids in front of the Louvre, taken at its opening in April 1989. And great architectures transcends time. 36 years later, my family and I went back to exactly the same spot where Mr. Pei once said, "We pondered the passage of time and the ingenuity and timelessness of his creation." He once said that architecture is a pragmatic art. To become art, it must be built on the foundation of necessity. So what it means is that you have to serve the needs of the clients. And indeed, over just under 20 years ago, the Chinese university campus had an unmet architectural need. And this is a Google map of the terrain of the Chinese university. The best way for me to describe it is a little bit like Ocean Park. So 2/3 of the campus is actually perched on a beautiful hill. And then the third is actually at the sea level, as you can see the greens and also the blue, where the beautiful lakes are. So put yourself into the shoes of our students. So you will be entering the campus via the university train station. And the first thing that you will see would be the CUHK College columns, the 2 doublets. And I'll go into a little bit more later about the words which are inscribed on them, the words which are legacies of our college president, Dr. D.Y. Lin. And then you will struggle to climb to the hills and find your classrooms. And for our faculties, we have found spaces for their different departments. And of course, you will have a great view of the Tolo Harbor, and on a beautiful day, you can see afar, well beyond Ma On San. But then, how do we connect the 2 parts of the campus? Ocean Park is easy, you just put some cable cars there. But obviously, for a great institution like our campus, we need something more meaningful and permanent. So therefore, we need to look at the values of our university. My Chinese is not very good, so I went to the official website, which translates what the couplets mean. The highest principle in relationship is universal love. Heavens and earth have ordained that the world is neither of the east nor the west, but to be united in a loving whole with learning and culture. And what does the other column says? The firmest foundation is the cultivation of scholarship, to be obtained here amidst the scenic hills and seashores where the society of man is molded and refined into a living community. So, how do you turn words into space and form? We need a magician in the form of Mr. Andrew Lee. And with a lot of effort, I managed to find this journal article, which was published in 2004, of an important interview, and now archived at the Hong Kong Institute of Architecture, in which Mr. Lee said, "Architecture creates an environment which enriches the lives of people and the whole community." These are some of his innovations, which I managed to find in the M+ Museum collection. Some of the original blueprints of innovations like block forms, scissor stairs, bay windows. These are innovations like magicians, transforming space into something which is pragmatic and aesthetically pleasing. So let's come back to this client. In 2012, a magic took place in the form of Yasumoto International Academic Park and related buildings, transforming CU campus and uniting the campus. So I was determined, just like my family, to experience the Louvre. So for great architecture, you have to actually go there. So I went there several times, and in a beautiful, very cold spring, one morning, 7 a.m., you have to go there in the morning because the sun will come from the east, and you will experience the warm lights streaming across the beautiful building. And while I was standing there, something strikes me. The trio of building, to me, reminds me of the Trinity, of opening arms, of those words inscribed on the column in the CUHK College doublet. The highest principle in relationship is universal love. And as you look at the center of the complex and you make your way all the way up the stairs, then you realize miraculously you are transported from the east and the west. The higher part of the university and the lower part are united in one. And this reminds me of those words inscribed on the column. The world is neither of the east nor the west, but to be united in a loving whole, learning and culture. And then I was determined to come back and look at this great piece of architecture at a different time frame. And you believe me, you have to go back at sunset. And this is a picture which I took around sunset. And you would see the beautiful hues of the sunset against those beautiful colors of the silhouette of our beautiful campus. But most importantly, you will see these students and staff gathering at the balcony, enjoying the moment, amidst scenic hills and seashores where the society of man is molded. So in summary, Mr. Andrew Lee and his associates, our magicians, have managed to turn words into space and form, turning our community into a living community. And then we'll go back to the drawing board and tell you a little bit about the storyteller. I'm very fortunate to have been the youngest of 3 children of Dr. Ma Park Wei and also Mrs. Nora Ma, who is in the audience today. And our family came from very old families in Hong Kong, and this is a picture taken at my parents' wedding in front of my mother's mansion, the ancestral home called Lo Chang Dai Tong, which used to be located at Argyle Street in Kowloon. So my parents were very loving parents, and they instilled important principles in our teaching. First of all would be duty. The other would be hard work, stoicism. The third and foremost is a solid education. However, I was the weakest link, and my brothers excelled academically, but I wasn't doing too well. So my parents decided to move the family to Melbourne and emigrated to give me a better chance. I love listening to my mother. In fact, she's a lot better storyteller than I am. And she used to tell me, my family has a tradition of serving the sick. And this is, in fact, a historic picture taken just after or before World War II, I hope I've got it correctly, of Deville Road in Hong Kong. And as you can see, Lo Jihoi, my great-grandfather, and Lo Yingquan, my grandfather, in fact, were very well-known traditional Chinese practitioners. And my grandfather, in fact, published a lot of articles on Chinese medicine, and some of which are displayed at the Hong Kong Museum of Medical Sciences. My father, Dr. Ma, graduated in dentistry at the University of Melbourne, and he was also into innovations as well. So this is a picture of him showcasing his first German-made Siemens dental suite in his clinic in Causeway Bay. My uncle, Kao Fu, Dr. Lo Wanshun, also was an innovator. He was the first cardiothoracic surgeon to introduce pacemaker to Hong Kong, and he was a team head at the Kowloon Hospital. He was also a bit of a Renaissance man as well, and he excelled in sports. He founded the Hong Kong Society of Archery, as well as had great taste in music and arts. And of course, my brother, he's my role model. He graduated at the University of Melbourne, and he holds twin specialties in both nuclear medicine. He's the head of his department in Geelong Hospital, and also he practiced as a rheumatologist. So there I was at graduation, wondering whether I should be an architect or whether I should follow family traditions. Architecture and oncology appears to be worlds apart. This is Mr. Ian Pei, Pritzker Prize winner. He says, the essence of architecture is form and space, and light is the essential element to architectural design. And you look across here, Dr. Mukherjee, he was a hematologist at the Dana-Farber Cancer Institute, and he won a Pulitzer Prize for a book on cancer called The Emperor of All Maladies. The essence of cancer is mutability, heterogeneity, and time is the most important community to people with cancer. Both research and compassion are the foundations of oncology. Block forms, bay windows, scissors are not mere architectural terms, they're creative solutions to enrich the lives of people. And for oncologists, chemotherapy, targeted therapy, immunotherapy, they are not medical terms, they are desperate solutions intended to extend the lives of people that we serve. So while I was pondering what to do, life took a different turn. My father became ill. And then in 1997, he succumbed to cancer. And like many families of people who died of cancer, we constantly ask the same question every day. So there was only one solution to find the answers to my questions, and which is to join medical school. And this is a photograph of myself, taken maybe a year or two before my graduation from the Monash University Medical School. So therefore, I'm going to talk to you a little bit about my journey and the important people who left footprints in my journey. So there I was, started my career. After graduation at the University of Monash, I joined the Peter Mac and became a medical oncologist, where Professor Danny Rishan over here introduced me to research in head and neck cancer. And then he said, Bridget, you have to find your niche. And being the only doctor who could speak Chinese at that time, I ended up taking care of a lot of patients with nasopharyngeal cancer, which is a unique cancer to the Cantonese people. And so I started surfing the web, and then I found the word Prince of Wales Hospital. And I knocked on many doors, and finally I was fortunate that Professor Philip Johnson granted me an interview where nobody would do that. And through that became history. And here I am in front of my two great mentors. Professor Anthony Chan has introduced and taught me everything I need to know about head and neck cancer. And Professor Tony Mock has taught me a lot about how different patients respond differently to drugs, the importance of one size does not fit all. After that, I still feel inadequate, and therefore I crossed the miles to visit Professor Lilian Siu, who is the first Asian and also first woman to hold the title of president of the American Association of Cancer Research. And from there, I spent a year at the Princess Margaret Hospital learning about how to develop new drugs. These are prototypes, drugs without names. Following that, I got a call from Anthony, and he said, there's a job as an assistant professor, would you like to come back? Of course, I was delighted, and from then on, I crossed many milestones with many truly bright minds, as shown here, and looking into ways of which we can improve the livelihood of patients with head and neck cancer and also GI cancers. Most importantly, I also crossed another important milestone where I met my husband and also my very good friends who are now in the audience. I'm also very fortunate to be able to work alongside some brilliant oncologists, very hardworking people dedicated to service, and become a mentor to truly bright medical students who are now also great doctors. And through my journeys across the world, I made a lot of friends in many different parts of the world, working together and looking into clinical research and bringing new treatments to our patients. Most of all, I'm very grateful to the European Society of Medical Oncology, of whom I have served for over 20 years, for providing me innumerable opportunities of bringing new congresses, new research, and also new educational courses for people living in the Asia-Pacific region. Last but not least, I'm very grateful to the various foundations for acknowledging our efforts. So many footprints indeed. But how do we measure the impact of footprints? Do we measure the size? Not really. Some footprints are very small, and they make very deep impressions. I think Chris will recognize whose footprint is that. That's Christina's footprint, only a few days old. Of course, patients who have left footprints in my life. Mr. Choi, Mrs. Wong, and Mr. Lee. They have one thing in common, unfortunately, and which was cancer. And this is an artist's impression, a schematic diagram of what a cancer cell looks like. And what we now know is that cancer actually were part of us. They originated from normal cells, but they turned against us. And how did they do that? Decades of research have told us that there are more than 14 ways in which cancer cells will try to turn against us. Some of these including changing the genetic programs, giving out signals, telling the cell to grow uncontrollably, or giving ways in which you can avoid the immune system from destroying them, or controlling various growth factors and acquiring the ability to invade different compartments of the cells, and even create their own blood supply system. And these cancer cells do not work in isolation. It also convinces other normal cells in its environment, in its neighborhood, to work with them against us. And mind you, our immune system tries very hard to get rid of them. There's a constant battle between our immune system and all these abnormal cells in a concept what we call immune editing. So there's a constant way in which our body tries to eliminate them, but ultimately, due to decline in the host immune system, cancer escaped. So how does precision oncology came into play? 有危就有機. Now we understand cancer a bit better, and we can better control it. As Tony has taught me, some cancers are different from the others. For example, like EGFR mutant cancers. They have what we call driver mutations. So to put it in a lay term, these cancers are driven by a single army general. So if you have a targeted therapy that target this particular mutation, the whole army will collapse. But obviously, they will find ways of overcoming the treatment. But then cancers like colorectal cancer and head and neck cancers, which I treat, they have over 10 to 12 driver mutations, which means that there are over 10 to 12 army generals. So even if one dies, the other ones will replace them. And as they spread within the body, they change constantly. So as you can see, different mutations are represented by different colors. So no two cancers are the same within the same patient. And even within the same tumor, no two tumors' neighborhood or their microenvironments are the same. So therefore, there's one thing in common about cancer is that it tends to escape treatment. And this is a diagram telling us what we see every day. Those patients in gray, unfortunately, are the ones who didn't respond. Those in different colors may respond somehow, 10 to 20% response rate, but a lucky few, especially if you combine the drugs together, may respond better and sometimes have incredibly durable remissions. So if cancer is a dynamic system, how do you study it? It's a very complicated system. And I think the best way is to use perhaps something that we're familiar with, the concept of like Google mapping. So going back to our campus, and just to orientate you, this is where we are located right now, on the top of a hill. This is a static image of the different buildings of the CU campus. You cannot tell where the students and the staff are located or what they're talking about. So therefore, if you click on another function in Google Map, you can actually look at the nearby traffic, and this is in Tolo Harbor, telling you whether there's any accident, any held up. And nowadays, it's even cleverer. You can look at it on the street level and telling you exactly where those people are and what they're doing. And this is what we're doing in studying cancers as well. One of the examples of which is colorectal cancer. The so-called multimodal technology, one of which is called spatial transcriptomic, is kind of making Google Maps of cancer. So let's look at this particular case of colorectal cancer. You take a very thin slice like Parma ham, and then you put them on a glass, and then you put dots and divide the ham into different compartments, just like neighborhood. And then you use a very special equipment to magnify it. And each of these dots are, in fact, little compartments of cells. And then you can identify the cells into, say, tumor cells, immune cells, stromal cells, and count them. And all of these little dots together produce a pattern, and these patterns can be correlated to the patient's outcome, and in this situation, consensus molecular subtypes in terms of the genomic landscape of colorectal cancer. It's very clever. And if you look at here, it's even cleverer. You can tell what the cells are doing and how they're talking to each other. For example, let's take this protein called TGF-beta. Imagine it's a bit like a different phone carrier A. And as you can see, if you divide the different cells into colors, the cells over here in green are actually using this phone carrier more often than the other cells are over here in purple, or those intermediate in here in red. So all in all, we can study cancers, but what really matters are our patients. The first patient I'd like to share with you is Mr. Cui Xin-sang. I call him the marathon runner because he was a very keen sportsman, and he fought nasopharyngeal cancer for 5 years, enabling him to participate in innumerable competitions. The median survival of stage 4 nasopharyngeal cancer used to be just under 1 year, and that was before immunotherapy. Why is it so deadly? Because if you look at this, nasopharyngeal cancer hides from our immune system, just like this cunning fox amongst the bloodhounds, unable to detect it. So when I first met Mr. Choi, unfortunately, despite conventional chemotherapy and radiotherapy, his cancer spread to his lungs. And he told me, and also told Edwin, we treated him together, and also with Anthony, he told him, I didn't mind the suffering and the pain, but I really wanted to continue as a marathon runner. It really meant a lot to him. So I'm very grateful to the efforts of the CUHK nasopharyngeal cancer team. And being a part of this team makes me very proud because, for example, looking at the tumor itself, I was fortunate to be part of Professor Lou Gok Wei and also his team, Do Gafei Gao Shao, in deciphering the genomic and the immune landscape of this complicated cancer. At the same time, we also study a lot using circulating nucleic acid technology, and I learned indeed a lot from Professor Dennis Loh and also Professor Alan Chan, and now, of course, Jackie. And through my collaboration with my friends, Professor Ann King and also Dr. Kenneth Wong, I was able to have radiomics analyses of our cancers. And throughout the years, we worked together and published in many high-impact journals. And these are only one out of many different milestones which we have achieved over the last 30 years. For example, introducing a new biomarker, plasma Epstein-Barr virus DNA, which help us to individualize treatment for patients. And for some of the projects which I'm unfortunate to be part of and also lead, including introducing new drugs, targeting the vascular system, targeting the EGFR, epigenetics, and most importantly, immunotherapy. So let's come back to Mr. Choi. Nothing seems to be working, so we went back to the drawing board. And what we've learned from the works of Lou Gok Wei and colleagues is that NPC has many army generals, many driver mechanisms, one of which is this. About 5% of patients, in pink here, actually carry amplification or multiple copies of this gene called PIK3CA. So we went back to the drawing board, took biopsies of his tumor, and lo and behold, his cancer harbored a PIK3CA mutation, which means it's one of the major driving mechanisms. We used a new drug, AKT inhibitor, which targets signaling downstream to this particular gene in the laboratory, and then we participated and led a phase 2 trial of this inhibitor for the first time in nasopharyngeal cancer in collaboration with the Mayo Clinic phase 2 consortium. Mr. Cho was the longest responder to this treatment, and for over a year, he was able to participate several marathons, and here, also showing off as well his trophies. At the same time, while his cancer unfortunately progressing, a new revolution was happening. In 2018, Nobel Prize, Dr. Honjo and Dr. Allison for the discovery of something called immune checkpoint proteins. In short, these proteins help our immune system to be blinded to the enemies from within. And so, at that time, around the same time, as part of the Mayo Clinic consortium, the NCI was soliciting in a competitive way, inviting ideas from investigators from all over the world. And there was this drug, it didn't have a name back then. We just called it 936558. And we won the solicitation. We managed to bring this new drug to Hong Kong, and Mr. Choi was the first patient enrolled into the study. It only worked in about 20% of patients, but the effect was remarkable. I had never seen anything like that in my career. Say this patient from America, his life was threatened by this recurrence at the back of his head, about to destroy his skull, and it disappeared for almost 2.5 years while he was on treatment. The result was so remarkable, we first of all presented the result at Washington at the American Association of Cancer Research Symposium. And subsequently, it also worked incredibly well for another patient, Mr. Chan, who survived for another 2.5 years on treatment. Unfortunately, it didn't work for Mr. Choi. He ran his last Hong Kong marathon in 2016, and a year later, one day, his wife, Clara, she brought back his last medal to me, and also his other medals to Edwin, reminding us every day not to forget about him. Immunotherapy has improved the prognosis of numerous NPC patients. This is only one of many examples of patients with widespread disease affecting the base of skull, lungs, liver in this case. Only 40-year-old man. He had immunotherapy and chemotherapy, and now his cancer is undetectable, both by liquid biopsy and also by imaging. Immunotherapy also benefits other patients with other cancers. Mrs. Wong, she was 63 when I first met her. She was threatened, her life was threatened directly by a tumor called triple-negative breast cancer. This is a picture of how big the tumor was, almost like the size of a watermelon, invading her heart. She told me, I wasn't afraid of anything, I just didn't want to suffer too much, but I'm keen to try something new. At that time, we didn't know a lot about PD-1, and also we didn't know a lot about immunotherapy. We tested her tumor and expressed a lot of copies of this protein. So we were fortunate to be part of a phase 1 clinical trial, one of over 150 trials, which we have conducted in collaboration with the phase 1 clinical trial center at the CU. So he participated in the trial containing 2 immunotherapies, and miraculously the cancer disappeared. Now it's just normal skin. And we are testing the same concept using the dual antibodies in nasopharyngeal cancer now. So over the years, we have published in different high-impact journals, but we have never forgotten why it didn't help Mr. Choi. This is our work in evolution. Very fortunate to work with Anthony, Edwin, and also all of our friends in the audience here. And here in the NEO-SPACE study, we are looking at NPC using Google Map technologies, single-cell sequencing, spatial transcriptomics, etc. So thank you, Mr. Choi. Thank you, Clara, for being here today. His resilience has been remarkable. And Clara, I've also taken up running as well. The other story which I'd like to share with you is Mr. Lee. When I met him, he was only 39. He fought BRAF mutant colon cancer for 5 years. What is BRAF mutant cancer? It's actually the most aggressive form of bowel cancer. New treatments have only emerged in recent years. And this is the army generals of colon cancer, over 10 of them. And 10% of patients suffer from BRAF mutant colon cancer. The median survival of this terrible cancer used to be just 8 months if it's diagnosed at a late stage. That was before targeted therapy was available. I still remember meeting him for the first time. After a brief illness, he was found to have widespread disease affecting most of the organs. The first question that he asked me was how much time he had. Because to him, what was important was whether he's going to be at the next Zhongcaoji with his family. So we made it a ritual that every year he continued to live, his family would send me a card. And here is a card on my desk from his son. And his son now is in high school. So how do we treat colorectal cancer? It used to be pretty heterogeneous. So I was lucky to be part of the ESMO community. And in 2016, I was invited as the only representative of the APAC region to Zurich. And there we formulated the very first ESMO guideline for managing patients, just like Mr. Lee. So we put him on chemotherapy. It was good for a year, but then the cancer progressed. So at that time, I remember the lessons from Tony. He said, Brigette, one size does not fit all. And so in this particular review at the Lancet Oncology, myself, Edwin, and I looked at why. And in fact, if you want to practice precision oncology, you cannot do it by yourself. It needs the whole team. I'm very fortunate to be part of the team led by Professor Simon Ng, Dr. Simon Chu, Dr. Jeanette Lee, Dr. Macy Tong, numerous names, all which I would like to acknowledge. And for their efforts in promoting precision oncology, we won the award for the best team in 2022. Also, we were keen to design a one-flow algorithm for patients with colorectal cancer. So the PRECURE program, in collaboration with Professor K.F. To and also my colleagues here in the audience, we were able to obtain biopsies from these patients, both from their tumors and also from their blood, and create laboratory models of them. These are what we call organoids, or also animal models, and then to perform drug testing. At the same time, I'm very lucky to have met Professor Xing Wang in the audience, who's talented, and his talents enable us to use artificial intelligence to give us a better perspective of all these complicated data. So through our program, we were able to take biopsies from Mr. Lee, and then we analyzed them and sequenced them, tested them in vitro in laboratory against many different drugs, and then we gave him feedback on how we should best treat his cancer. And thanks to the efforts of Dr. Jackie Lam, and also my, it's now a doctor, my student mentee, Rachel, they even designed a special blood test to monitor Mr. Lee's cancer progress so we could catch it before it became radiologically evident. For the next 4 years, after more than 5 different lines of targeted therapy, Mr. Lee managed to survive and work and also support his family. And for the effort, Rachel and also Jackie won the Merit Award in ASMO and also Innotech Scholarship. Unfortunately, things didn't go too well. And after multiple rounds of surgery, and just before I was yet to obtain more biopsies to create a xenograft model and then other organoids, this time around, he told me, I have bad news for you, Dr. Ma. You see, usually oncologists break bad news, but this time around, it was him breaking the bad news for me. He said, Dr. Ma, I don't think my body can handle this anymore. I want to stop treatment. So I have to get used to not treating him, having looked after him for 5 years. So this was a picture which I've taken at the CU campus after I saw him for the last time. He departed us in 5:30 a.m., and this was taken at about 6:30. It was very peaceful, and I could also feel the peace from his family. So therefore, in collaboration with my colleagues from Singapore and also from Korea, we have just established a new oncology group dedicated to colorectal cancer research. So therefore, we come back to the drawing board. And as you can see, as many things in life, things come back in a full circle. And just like this little tiny footprint, it's now a very healthy size 7.5. This was taken at Fontainebleau only a few weeks ago. We had a family holiday. So architecture, oncology. What have I learned over the last 30 years? Space in architecture, but without light, there's no form. In oncology, time is important, but research is what extends it, and what makes time meaningful and also tolerable was compassion. Faith, hope, and love, which is more important. This was taken only a few weeks ago. Our new generation of doctors, I'm very proud of them, taken at what we call the white coat ceremony. So we have very lucky to have our new generation of doctors giving us faith. So I have faith in my mentees. The others hope. This was taken at the photo ceremony, which we remember fondly. And hope is important because sometimes in research, we may not find the answers. As you can see, some of these ended up being on the ground. And I always tell my students, failures are not setbacks. Failures are lessons. You should pick up your hat, put them back on, and move on. But last but not least is love. This is Rachel, telling me that she's won the Innotech Scholarship, one of the happiest moments in my professional career. And then I look at the back and realize universal love is important. Sometimes we go through life thinking that we're all by ourselves. But in fact, there are some higher spirits behind us in the shape of a dove. This was actually taken by myself in Lake Lugano in Switzerland. And they're also in the shapes of people like Mother, my brothers, whom I owe my life to, and of course, Chris and Christina for putting up with me and accepting who I am and allowing me to make all those travels. And thank you, Tony, for approving them. And of course, my relatives present, my friends and colleagues who have made footprints in my life. And most of all, my heartfelt thanks to Mr. Andrew Lee, Mr. Douglas Lee, and of course, Anthony. Thank you very much.
Thank you very much, Professor Ma, for your inspiring lecture. May I invite you to take your seats for a group photo. Would the audience please look at the camera for the group photo? Ladies and gentlemen, that concludes the inaugural lecture. Please rise as the official procession exits the hall. Thank you everyone for joining us today. Wish you a good evening ahead.